We all feel down sometimes. Life throws curveballs. It's natural to feel sad, blue, or discouraged. But what if these feelings linger? What if they become so intense they take over your life? This is the reality for millions grappling with depression. Depression is not just a case of the blues. It's not a weakness or a character flaw. It's a serious medical condition, a disorder that disrupts the delicate balance of brain chemistry. This imbalance affects emotions, thoughts, and behavior, casting a long shadow over every aspect of a person's life. Imagine waking up every morning with a heavy weight on your chest, a feeling of emptiness that follows you throughout the day. Simple tasks, once enjoyable, now feel insurmountable. This is the reality of depression for many. It's crucial to understand that depression is incredibly common. Statistics paint a stark picture. Millions across the globe are affected by this disorder. It can impact anyone, regardless of age, background, or social standing. The first step to tackling this widespread issue is understanding it. Depression doesn't wear a uniform. It manifests differently in each individual, making it even more challenging to recognize and address. Some people experience a persistent low mood, a constant feeling of sadness and despair. Others might feel emotionally numb, disconnected from the world around them. Changes in appetite and sleep patterns are common. Some people might experience insomnia, while others find themselves sleeping excessively. The same goes for appetite. Some lose their desire to eat, while others seek comfort in food, leading to fluctuations in weight. Concentration becomes a struggle. Making decisions, even simple ones, feels overwhelming. The world seems shrouded in a fog of fatigue and hopelessness. These symptoms seep into every corner of life, affecting work, relationships, and overall well-being. It's important to remember that there's no single experience of depression. It's a deeply personal journey, and understanding the varied ways it manifests is crucial for both those experiencing it and those who want to help. The causes of depression are as diverse as its symptoms. There's no single gene or life event that flips a switch, plunging someone into the depths of this disorder. It's often a complex interplay of factors, a perfect storm brewing in the mind and body. Past trauma can leave deep scars on the psyche, making individuals more vulnerable to depression. Childhood abuse, neglect, or witnessing traumatic events can have a lasting impact on emotional well-being. Genetics also play a role. A family history of depression can increase the likelihood of developing the disorder. Life circumstances can act as triggers. Job loss, the death of a loved one, financial strain, or chronic illness can disrupt our emotional equilibrium, pushing some individuals towards depression. Our brains too hold clues. Imbalances in neurotransmitters, the chemical messengers in our brains, are implicated in depression. These chemicals, like serotonin and dopamine, play a crucial role in regulating mood, sleep, and appetite. Medical conditions such as thyroid disorders or chronic pain can also contribute to depression. Substance misuse, including alcohol and drug abuse, can worsen existing mental health issues or trigger depression. Understanding these potential causes is crucial for developing effective treatment strategies. Witnessing a loved one battle depression can be heartbreaking. It's natural to feel helpless, unsure of how to offer support, but there are steps you can take to make a difference. Firstly, educate yourself about depression. Understanding the disorder is the first step to offering meaningful support. Read articles, talk to professionals, and challenge any misconceptions you might have. Secondly, listen without judgment. Create a safe space for your loved one to share their feelings without fear of criticism or shame. Avoid offering unsolicited advice. Instead, focus on simply being present, offering a listening ear and a compassionate heart. Finally, encourage them to seek professional help. Depression is a treatable condition, and early intervention significantly improves the chances of recovery. Offer to help them find a therapist, accompany them to appointments, or simply remind them that you're there for them every step of the way. Remember, recovery is possible. With the right support, understanding, and treatment, those grappling with depression can reclaim their lives and rediscover the joy that once seemed lost.